Guide to the graphic. Here we have a cross-section of the brain. Hemiballismus, a violent involuntary movement that occurs with destructive lesions of the contralateral subthalamic nucleus, the corpus luci. The abnormal movements of hemiballismus occur when at least 20% of the corpus luci is destroyed. However, the substantia nigra, pyramidal tract, and red nucleus must be intact. Although a variety of pathologic processes, for example, metastatic tumors, cysts, and infectious diseases, can be underlying causes, most cases result from vascular lesions, either hemorrhagic or occlusive. Consequently, these movements occur in older patients sometimes after a transitory hemiparesis from a stroke. As the neurologic signs of the stroke clear or sometime later, the ballistic movements begin. They do not occur during sleep, are localized to one side of the body, and involve the limbs in a forceful throwing movement, a result of almost continuous activity of the proximal musculature. The arm and leg may be equally involved, but involvement of one is usually more prominent. The neck, tongue, or face may also be affected. Initially, the violence of these movements may exhaust and incapacitate the patient to such an extent that death ensues. However, the initial intensity usually decreases gradually so that the movements become tolerable and can be somewhat suppressed or briefly interrupted by voluntary action. In about 6 to 8 weeks, the movements stop spontaneously, particularly when the cause of the hemiballismus was an occlusive vascular lesion. When tumor provokes hemiballismus, movements persist. And that's hemiballismus. Have a great day.